So what are the oral hypoglycemic drugs? The name itself suggests oral in the sense they are effective orally. Hypoglycemic means they lower the blood glucose level. So these drugs are given mainly to lower the blood glucose level and given orally. So these drugs are useful in the treatment of type 2. They are not prescribed in the type 1 diabetes. Sometimes insulin is also given with the oral hypoglycemic drug for the treatment of type 2 diabetes whenever there is a progressive decline in the beta cell. This is a classification of oral hypoglycemic drugs. So basically, they divided into 3 classes, and out of these 3 classes, 2 classes are very important. First one, enhance insulin secretion, means these drugs will going to increase the insulin secretion from the pancreas. Out of these 4 classes are there: sulfonylurea, meglitinide, GLP-1 receptor agonist, DPP-4 inhibitor. So out of these, first 2 are acting directly on the pancreas, and next 2 are acting indirectly to increase the insulin secretion. Next one is overcome insulin resistance. Under this class, again, it have different subclasses, which is called as biguanides and thiazolidinediones. So these are very important drugs in the cases of insulin resistance. Means these drugs will going to act on the peripheral target organs, and on these target organs they will reduce the insulin resistance. And next class is miscellaneous drugs. So these are the drugs which are working via the different mechanism through which we can able to get the decrease in the blood glucose level indirectly or directly. Now we're going to talk about the sulfonylurea. Sulfonylurea comes under the class enhanced insulin secretion. There are 2 subclasses under this category. First is first generation and second one is second generation. First generation in the sense they were synthesized or invented earlier as compared to the second generation. So drugs include that tolbutamide. Second generation drugs are there. There are the glibenclamide, glipizide, then gliclazide, glimepiride. So these are the second generation drugs are very much superior than that of the first generation, and they are very potent as compared to the first generation. So basically they are called sulfonylurea because they are having the sulfonylurea moiety into their structure. And these sulfonylurea are derived from the sulfonamide derivatives, which is used as an antibiotic. In the sulfonamide treatment adverse effects, it is found out that this sulfonamide are causing the side effect lowering the blood glucose level. So from that onward, this sulfonamide were all used in the treatment of the oral hypoglycemic. So these all sulfonylurea have the same pharmacological action, and they are very much active in the lowering the blood glucose level. They mainly given in the treatment of type 2 diabetes. They also have the capacity to decrease the blood glucose level in normal subjects. And these drugs are not given in the type 1 diabetes because for the action of these sulfonylurea, the intact pancreas are required. In the cases of type 1 diabetes, there is a total loss of beta cells, and due to that, these sulfonylurea are not able to act in the type 1 diabetes. So nowadays, only second generation sulfonylurea are in the use because they are more potent and clinically superior. Out of first generation, only tolbutamide are used infrequently, and other drugs are not used nowadays. Now we'll see about the mechanism of sulfonylurea. Sulfonylurea acts as an insulin secretion enhancer. Their target located on beta cell of pancreas. They bind to sulfonylurea receptor on beta cell. To understand this mechanism, we should be aware with physiological insulin secretion mechanism. This we already studied in insulin secretion section. Normally after meal, when blood glucose level high, then only beta cell takes glucose via GLUT2 transporter. This will increase glucose entry into beta cell. Beta cell have enzyme hexokinase which acts as a glucose sensor and detects glucose and metabolize it by glycolysis and produce the ATP. This increased ATP causes ATP sensitive potassium channel to close. This channel keeps insulin secretion release minimum. After closing of potassium channel, depolarization of cell occurs. And this depolarization causes voltage gated calcium channel to open, allowing more calcium to enter into the cell. Because of that, there is an exocytosis of insulin vesicle and increased insulin secretion. So these sulfonylurea have a target on these ATP sensitive potassium channel. So binding to this ATP sensitive potassium channel, they close these channels, and closing of this channel cause the depolarizing of the membrane, and depolarizing of this membrane causes the calcium entry into the cell, and due to the calcium entry there is a exocytosis of insulin vesicle and increase in the insulin secretion. Sulfonylurea, apart from direct pancreatic action, have extrapancreatic action also. They act on target cell, especially on the liver, and cause increase in the insulin receptor. This increase in the insulin receptor causes sensitization of target cell to the insulin action. They also inhibit gluconeogenesis in liver and also have post-receptor action. Due to that, there is an improved translation of receptor action. Means they promote the synthesis of receptor protein so that the upregulation of insulin receptor is mediated. But after a few months of administration, there is a decrease in insulin action due to the downregulation of sulfonylurea receptor on beta cells. But the peripheral effect is not declined by the cell. There is an improvement in the glucose tolerance is maintained as further. Pharmacokinetic of sulfonylurea. About the absorption, they are well absorbed orally. Distribution, very high plasma protein binding, that is 90%. Very less amount available for action, so they having the low volume of distribution. About the metabolism, they metabolize in liver, excreted in urine by kidney, and there should be a precaution need to be taken in patient with the kidney and liver disorder. They also secreted in the milk, so should not be given to the nursing mother. Also during the pregnancy, it is not recommended as the safety data not yet established. According to the onset and duration of action, there are the subcategories like short-acting drugs in which tolbutamide comes. There are intermediate-acting glipizide, gliburide, in the long-acting glimepiride, glyclazide. And about the glibenclamide, it is 150 times more potent than that of the tolbutamide. Adverse effects of sulfonylurea. They have very low incidence of the adverse effects, about 3 to 7%. First one is hypoglycemia. It is very common with anti-diabetic. In this, it occurs occasionally, sometimes severe, and rarely fatal. Next side effect is non-specific side effects like weight gain. It occurs mainly at the start of the anti-diabetic treatment. It can gain up to 1 to 3 kg of the weight. And there are few mild and infrequent side effects like nausea, vomiting, flatulence, diarrhea or constipation, headache, paresthesia. Paresthesia in the sense pricking like sensation. Next side effect is hypersensitivity. It occurs mostly in the sensitive people. The effects like the rashes, photosensitivity, purpura, leukopenia, or granulocytosis, which occurs rarely in the patients. Drug interaction of the sulfonylurea. So basically, sulfonylurea interact with the drugs, and that can cause the enhance in the sulfonylurea action or decrease in the sulfonylurea action. So first we're going to see about the drugs that enhance the sulfonylurea action. And due to increase in the sulfonylurea action, there will be the hypoglycemia. So first class is displaced from the protein binding. This is a mechanism by which they enhance the sulfonylurea action. As we know that sulfonylurea binds to the plasma protein around 90%. So they are displacing from the plasma protein binding, and because of that their free form will get increased, and that will cause the hypoglycemia. So drugs that cause this thing is phenylbutazone, salicylate, sulfonamide, sulfonylurea. Then another category of a drug which inhibit the metabolism or excretion of the sulfonylurea. So again, due to this, they will get increase into the blood and they will cause the enhanced sulfonylurea action, like the cimetidine, ketoconazole, sulfonamide, warfarin. So these are the drugs involved in such a mechanism. Next mechanism by which they enhance the sulfonylurea action is synergizes with the sulfonylurea or prolong the pharmacodynamic action of the sulfonylurea. So these are the drugs like salicylate, propranolol, lithium, theophylline. So all these are the drugs increases the sulfonylurea action. So now we're going to talk about the next category, that decrease in the sulfonylurea action. And due to the decrease in the sulfonylurea action, there will be the failure of diabetic therapy. So by which mechanism they are causing this? First one is induced metabolism. So these drugs will going to increase the enzyme that cause the metabolism of sulfonylurea. So which are the drugs are that? Phenobarbital, phenantone, rifampicin. So all these are the drugs included over there. And next category that cause opposite action or suppress the insulin release. So as we know that sulfonylurea increase the insulin release. So these drugs acts opposite manner. So because of this action, there will be the decrease in the sulfonylurea action. So which are the drugs are there? Corticosteroid, thiazide, furosemide, oral contraceptive. So whenever we are taking the drug with such an interaction, we need to adjust the dose according to the action.